Hi, this is Dr. Srimannarayana, surgical gastroenterologist, laparoscopic surgeon. Today we are discussing one important topic, that is Gastro Esophageal Reflux disease with hiatus hernia. Okay, coming to the basic difference between the gastritis and Gastro Esophageal Reflux disease. The gastritis means there is the only burning sensation in our stomach part. This is called as the stomach part. So we have only the burning sensation in the stomach part. Coming to the reflex, gastroesophageal reflex, this is the food pipe, what you call it as technically esophagus. So any acid coming from the stomach into the food pipe, that is esophagus, we call it as a gastroesophageal reflux disease. So the main difference is, if it is only have gastritis, you will get only burning sensation in the stomach. If you have reflux disease, you will get the burning sensation in the chest, sore throat also. Okay, why the people will get the gastroesophageal reflux disease. So this entire part will be in the chest wall. From this part to this part of food pipe will be in the abdominal wall. So last 2 centimeters of your esophagus should be in the stomach part only. And if you see any part inside, this is the junction of the food pipe and the stomach. This part will be guarded by one sphincter. So it will allow only one-way traffic. The food will come from above to the stomach area, but acid will not go into the esophagus area. This part will be protected by one sphincter. Suppose if the sphincter is damaged, you will get the reflux into the esophagus. Suppose this last 2 part is not in the abdomen wall, that positive pressure will not be there, you will get the reflux. And this last part will be separated by our diaphragm, that is the separation between the chest wall and the stomach. If that is damaged, that is also you will get the reflux. Coming to what is the meaning of hiatus hernia, what is the exact meaning of hernia is, any part which is normally presenting in one area, if we go into other area within our body only, that what you call as hernia, like a inguinal hernia. The inguinal hernia means the intestine or fat, that is omentum, coming from the abdomen into the scrotum area. Normally where should it present? It is in the abdomen. If it is coming into the scrotum area, that is from one part to other part, that is called as hernia. If suppose coming to the umbilical hernia, so the intestine or omentum will come along into the umbilicus below the skin, that is umbilical hernia. If any person go for surgery, that part will be weakened. From weakened part abdomen, the intestine will enter into the below the stomach, that is hernia. The same concept is, this last 2 parts should be in the abdomen. If it is last 2 part will enter into this chest area, that is called as hiatus hernia. Okay, so what we do, what is the complaint on what we do? The complaint is recurrent reflux disease, because as I told, this is the structural problem. Last 2 centimeters, if it is not inside, it is a structural problem. If any sphincter damage, that is the lax lower esophageal sphincter, that is the structural problem. If the diaphragm is weakened, that is the structural problem. Here a small pad of fat will be there in this, along these lines. If that is weakness, that is the structural problem. Any structural problem should be treated by surgery only. There is no medications for structural problems. We'll try for 15 days to 1 month of medications. If the patient is not responding to that medications, the patient has to go for surgery, because it is the structural problem. Gastritis is the different, because if you have any anxiety, food is not intake is not good, outside food, everything should be there, you will get the gastritis. That is our life habit problem and our sleep problem. So if you have to manage with the medications, but reflux is structural problem. So what is the surgery? The best surgery is always the laparoscopic fundoplication. That means I will make the esophagus 2 centimeters into the abdomen, and again the esophagus should not go into the stomach again. So I will use this stomach part around this area, like this one. Okay, this is called fundoplication, like our pillar structure. Suppose if you are making any building, you can't make the cylinder directly into the earth. You will make a base, then again one cylinder will come, because the cylinder will not go, it should not go inside the earth. So the same concept is the esophagus should be wrapped with the stomach, so to make it will not go above, like through your diaphragm. So this is the surgery, laparoscopic fundoplication. The hospital stay is not more than 2 days. The patient should take only liquid diet for 1 week. After that, patient can take the soft diet or normal diet after 1 week. There is no diet restrictions nowadays. Third one is what is the complications after this surgery. If I make tight wrap, the patient can't bloat. This is called as the bloating one, because the bloat means gas should be empty out, right, this through this valve only. So if I make very tight, the bloating will not, the patient can't bloat. If I make very loose one, the surgery will be failed up. So we have to guard it and make it tight. This is the only complication. There is a very rare complications. Okay, and the lifestyle modifications should be there. Should not eat outside food very regularly. Occasionally we can eat, because nowadays we can't avoid that one. Okay, and second thing is sleep should be at least 6 to 8 hours, and there is should not be stress and anxiety in our life. Work is the work, family life is family life, personal life is personal life. Don't mix all together. Thank you so much.